Hi, today we're going to do a video for Rose. My daughter and I know Rose from a hair salon and she stands all day long, and she requested something that would alleviate her back pain after standing all day long. So I'm going to use 2 blocks. If you don't have blocks, you can use a rolled up blanket or a couple of firm pillows. And then you'll also need a blanket for underneath your head. And we'll start lying down on our backs. And you'll just need a little bit of height under your head, nothing too high. And you'll cross your right knee over your left knee, just like you're sitting cross-legged in a chair, and hug your knees into your chest. We're gonna stretch your glutes. So if your chin is higher than your forehead or the back of your neck is shortening or feels tight, you're going to need to elevate your head a little bit higher. So you could fold up your blanket a couple times or add a pillow. And while you're doing this cross-legged stretch, you can hold onto your left knee over the top of the knee or the back of the left thigh. You want to avoid any pinching in the front of the hip joint. So if you do feel pinching, you're going to back off. You could take like a towel and wrap it behind the thigh and hold onto the ends of the towel, or a yoga strap, or even another blanket. But you don't want to hug so tightly that you feel pinching in the front of the hip. Once your glutes have started to open, you're going to hold on to the ankles. Now this may or may not be accessible for you. So you could stick with the holding of the knees, or you can hold on to your shins, your ankles, and you want your feet to be equidistant from the ground. So you'll make your shins approximately parallel to the ground and parallel to the ceiling, so they're horizontal. And you can do a little bit of a rock side to side. Even though you are using your arms, see if you can let your shoulders relax down, keeping the facial muscles relaxed so the face is wide open. Then you'll lower your heels down towards your hips again. Step your left foot down to the ground. I'm just going to drop your knees over to the left and then sway the knees over to the right. And you'll inhale through center, knees sway to the left. Feel your right shoulder widen out to the right. Exhale through center, inhale, knees sway to the right. And let's do that one more time each side. And then you'll drop your knees over to the right and you'll stay there. You can take your left arm up on the diagonal towards like 2 o'clock, 1 o'clock, and gaze towards your fingertips. Or if that feels like strain on your neck, you'll just keep your head straight up to the ceiling. You can take your right hand to your left pelvic half and encourage that left pelvis to turn to the right, very gently. You're not trying to pull too hard into this twist. Inhale deeply into your left lung, feeling the left ribs widen out to the left. And as you exhale, allow the left rib cage, the left lung to drop into the ground. Do that one more time. Nice deep, wide breath into your left lung. And exhale, the left lung drops. You'll bring your knees back to center. Hands down by your sides, palms face down. Uncross your legs and have your feet standing on the ground, knees bent. And just feel the difference between the 2 halves of your body. We did a pretty deep stretch for the right glute and a pretty deep stretch for the front of the left hip. So you might feel a little bit twisted or lopsided here. And we'll do the other side. Cross your left knee over your right knee. Hug your knees into your chest. And again, you can hold on to the front of your right knee or the back of your right thigh. No pinching in the hip socket. So you might need some kind of towel or strap to loop around the front of the knee or the back of the thigh to extend your arms. So there's no pinching in the front of that left hip joint. Now, as you breathe, you want to feel your breath expand the tissue of your pelvic floor. So the musculature of the pelvic floor spreads wide open. As you inhale and as you exhale, it draws up into the pelvis. So the sitting bones are getting wider. The tailbone is unfurling out of the pelvis towards the ground. And then if you're ready to progress, you can hold onto your ankles and parallel your shins to the ceiling and the floor. So your shins are horizontal. It's kind of like you're holding handlebars here. And the foot that your left hand is holding is probably going to need to go a little bit higher up to the ceiling. It gets a little confusing which foot is which here. And the foot that your right hand is holding, you could try pushing it out to the right. And if it feels good, little rock side to side, massaging the low back down into the ground. Shoulders releasing down. Breath full and wide into the back of your lungs. Lower your feet down towards your hips. You can step your right foot down to the ground. And you'll sway your knees over to the left as you inhale. And then exhale back to center, and the knees sway over to the right. Inhaling, the knees sway left. Just doing a gentle twist. If this causes any pain, discomfort, you move more slowly and you make your movement smaller. So maybe the knees don't drop as far down to the ground. We'll do one more time each side. Keeping your eyes soft, face is relaxed, jaw is relaxed. And the next time that your knees sway to the left, you'll leave them there. Take your right arm up on the angle. I'm getting rid of my pillow. I don't really need the pillow for this stretch. You might decide you need it or want to get rid of it. You can turn your gaze to look up at your right fingertips. My right arm is reaching up towards like 11 o'clock, 10:30. You want your right shoulder to be pretty much on the ground, so maybe the arm can't go as high. You might need to bend the elbow and just take the right arm straight out to the right, more towards like 9 o'clock. And then your left hand on your right pelvic half is there to give a little bit of weight, drawing the pelvis to the left and down, but not pulling on it, just allowing the passive weight of the arm to encourage a deeper stretch. Breathe full and deep into your right lung, and on your exhale, your right lung will drop towards the ground. Maybe in the stretch you can even sense the tissue of the right side of the pelvic floor, the posterior pelvic floor around the tailbone, the sitting bones, expanding, stretching with your inhale. Allowing the low belly to soften, so the low belly inflates as you inhale. And on your next exhale, draw the navel in to support the spine. Bring your knees back to center. Uncross your legs, place your feet standing. And you can have your knees together, your feet wide apart. Cross your arms over your chest so your arms are stacked, one on top of the other. You're just going to take a few breaths here. Sensing the spread of the ribs behind the heart, between the scapula as you inhale. Sensing the spread of the ribs a little lower down at the bottom of the thoracic spine, the bottom of the rib cage as you inhale. And as you exhale, the breath drops. The front body drops into the back body. You'll switch which arm is on top. Keeping the jaw relaxed, the throat open. Your inhale moves through your nose, down your throat. Spreads into the right lung, the left lung, wide into the body. tongue is resting at the roof of the mouth. And you'll uncross your arms, place your hands down by your sides, heel toe your feet into hip socket distance. And then we're going to take one of your yoga blocks, or if you don't have one, you can roll your blankets up and make a pretty big, firm bolster. And you're going to put your block underneath your pelvis, maybe on the low setting, try that, see how that feels. Maybe you go a little bit higher, see how that feels. And if you can go even higher, you turn your block up to the highest setting. Now my blocks are a little squishy and wobbly, so I'm actually going to take 2 blocks and stack them one on top of the other. So low setting, 2 blocks stacked wide across the pelvis. And you want your hips to be as high as they can be without pain. So if there's any discomfort in your low back, you lower down until there's no discomfort. You might even just be on a blanket, so you're only lifted a few inches off the ground. And then you'll take one leg up to the ceiling and the other leg up to the ceiling. And we're just gonna let your feet rest here. So this gentle inversion is really good for the blood flow. You can do some ankle circles. Switching directions if you're circling your ankles. Flex the heels, spread the toes, and reach the heels up to the ceiling, and then you'll point the feet, trying to brush the ceiling with your toes. Do that a couple more times. You're going to spread the toes, flex through the ankles, and sharpen the back of the heels up to the ceiling. And then you point the toes, growing the toes longer and longer. We end up gripping our toes a lot of the time when you're standing. You want to really reach the toes long. Do that 2 more times. Spread, flexing the toes, the ankles, reaching up to the heels. And then spread the toes and grow long, like brush strokes, painting the ceiling with your toes. And then you'll just let your feet kind of relax. Legs might feel a little bit noodly here. You want to allow the femurs to drop, the thigh bones to drop down into their sockets. Your pubic bone at the bottom front of the pelvis is lengthening through the legs, away from the sternum, the breastbone, and your tailbone is releasing down to the ground. You might start to feel a little bit of tingly in your feet. If it becomes uncomfortable, you can step your feet down. We'll be here for another 30 seconds or so. Even though your pelvis is elevated, can you fill this negative space underneath you with your breath? So imagine that your breath could move behind you, down into the floor, and brush wide across the ground underneath you. So the ribs are nice and heavy. And then you're going to keep your legs up. Let's reach out through the balls of the feet. So like you're wearing the little high-heeled shoes, Barbie toe feet. You're going to lower one leg down. Take an inhale. That leg is reaching long. You only go as low as you can keep your ribs heavy. If your ribs start to pop up, you've gone too low. And on your exhale, lift the leg up. Other leg reaches down. Inhale, press out through that leg like you're reaching through a wall. And then exhale, abdomen draws in, leg comes up. Let's do a couple more times each side. Inhale, reaching. Back ribs stay heavy. You can even keep your hands on your front ribs so you can feel if you're popping those front ribs open. Exhaling the leg up. Inhale to lower. Maybe you go a little bit lower. Ultimately, you would touch the ground, but we're not going to sacrifice our spine just to reach the floor. Inhale to lower. Exhale to lift. Inhale, lower. And as you lift, you grow longer through that leg. You're reaching the leg out of the pelvis. Let's do one more time each side. Lowering as you inhale. Reaching out through the leg as you lift. Inhale to lower. Exhale to lift. From here you can bend your knees. Step one foot down, other foot down. Again, if it's too much on your back, if your ribs are really popping up, or if you have pain in your back, you're going to remove one of the blocks or take one of the blocks lower. And then arms can rest down by your sides, palms face up. You could even have your arms over your head in this cactus position. And we'll stay here for a few more breaths. Head is heavy. Feel your shins gliding down into your feet. You're still sending your inhale down the spine, imagining that the breath could fill the space underneath you. And then you'll press your feet down, engage your pelvic floor, so lift the pelvic floor up, lift your pelvis, take one of the blocks out, or just turn your block down to the medium setting if you were high, or from the medium setting down to the low setting. And we'll come down gradually out of the hip extension. And then if you need a pillow under your head when you're lying flat on the ground, you'll grab that now. You can put your pillow back under your head, press your feet down, lift your pelvis, and you'll lower all the way down to the ground. Knees together, feet wide, or if you do have your two blocks or maybe two pillows, you can have your feet together, knees wide apart, and rest in a Supta Baddha Konasana position. Arms can be up at cactus or down by your sides, palms face up or out to the side. You definitely do want support underneath your knees here. If your knees are just hanging in space, the thigh bones are pretty heavy and the femur heads will get pushed forward in the socket, which is something we definitely don't want. Those ligaments over time will get overstretched. Close your eyes. Cheekbones wide. Feel the rise and fall of your breath. And enjoy the pauses at the end of every exhale. You don't have to force it, but there's a gentle pause as the pendulum swings from the exhale back to the inhale. And allow that pause to happen. And then bring your knees together and roll over to your side. Pause for a moment on your side with your knees curled up into your chest. Rest your head. And then you'll turn your heart towards the ground, so you spiral yourself and come up to sit. And then you can sit cross-legged or maybe in Virasana, kneeling on one of your blocks. So I've got the block wide ways underneath the sitting bones, between the heels. Rest your hands in your lap and close your eyes. Feel the tailbone, the back of the pelvis, the back of the sacrum glide down. And from the very bottom of your spine, you're lifting up off of the top of your sacrum, up behind the heart, all the way up into the crown of the head. Nice wide open shoulders, broad sternum. Your inhale is traveling up the front of your body and your exhale is gliding down the back of your body. Bring your hands to prayer. Seal the prayer up against your sternum and bow your head. Place your hands down, float your head up, and open your eyes. Thank you for joining today. I hope that helps alleviate some of the tension in the legs and the low back. Have a good day. Bye.